All right, hello everyone. I'm Bart Barker with Wilson County Schools. I'm joined here by Chuck Whitlock. He is our Wilson County Schools Health Services Supervisor. You have been likely no stranger to Chuck if you've watched a school board meeting in recent months. Chuck has been a tremendous asset, even pre-COVID, but now more than ever as he provides lots of information on protocols. I know a lot of parents. He's provided a lot of information to parents and students and the administrative staff here at the Wilson County Schools office at 415 Harding Drive in Lebanon. So let's just get right to it, Chuck. I know parents have had questions about a lot of things, and now that we are in school, we're in session now through our hybrid model. Let's just start with things. And before we dive into it, this right here is what we're going to go over. In this sheet right here, our COVID-19 parent protocols, that link is included in this post or this email, however you are receiving this. So just know that that's there for you, but we're just going to go along with this sheet on the COVID-19 parent protocols. Chuck, let's jump right in. If someone in the home has tested positive for COVID-19, what should they do? What is the very first thing they should do?
Number one thing, and everything hinges off of communication. Mm-hmm. So if there are symptoms, we definitely want folks that are feeling ill to stay home and contact us. If student, staff, or family member that lives under the same roof tests positive, we need to be contacted. Mm-hmm. Contact your school. We've got our administrators, nurses, and central office staff. We've got a plan of action, and we just kick into it and just start going step by step. So communication really gets things going right off the bat.
So in saying that, let's focus on isolation days, quarantine days. Let's go over a few scenarios if someone has tested positive for COVID-19 in the home. So let's just start with that. We notified school. After that, what happens?
Okay. And I'll just say just a little bit here. This has been a bit of a moving target for schools all over the state. There were some recommendations early on that are not recommendations anymore. They're mandates from the Department of Health. So we're partnering with the Department of Health on all this stuff. It's not just Wilson County making things up. It's right. Every school system. Probably the easiest one to explain. Let's just say a student were to test positive. Student or staff test positive. They're going to be, after it's reported to the school and the Department of Health gets involved, there's going to be a 10-day isolation period for a symptomatic individual, whether it be staff or student. If they're having those symptoms, they are going to start the 10-day isolation period at the onset of those symptoms. That's going to be a history taken by the healthcare provider, interviewed by the Department of Health contact tracers, but there'll be a 10-day isolation period for anybody that tests positive. And if it's symptomatic, it starts with onset. If they're asymptomatic, sometimes we have people that will test because of possible exposure, but they don't have any symptoms whatsoever. That 10-day period is going to start when they took the test.
Okay, gotcha. Okay, that makes sense. I think this is where this next question I want to ask you, it gets a little fuzzy and confusing, rightfully so. This stuff it can be, so don't feel like this is just easy 101 stuff. It can get confusing because information changes a lot. Okay, quarantine, 14 days. It says child follows medical orders to isolate for a minimum of 10-day period from onset of symptoms or positive test day. It says from then, quarantine 14 days. Child then quarantines for a period of 14 days following that isolation period. Okay. Kind of go into that a little bit.
That would only be, and I'll back it up and use a real world example. The quarantine is a 14-day period for those they've not tested positive, but they've been in close contact with somebody that has tested positive. Just to put the 14-day quarantine on its own, let's say that we had a positive case in the school and the administrators have been working extremely hard. We're not throwing everybody into the close contact pool, but they do their investigation. They determine that a handful of kids were in close contact, which is 6 feet, within 6 feet for 10 minutes or longer. If they check that box and a student or staff member is determined to be in close contact, then that person is going to need to quarantine at home for 14 days from the last date of contact.
Right.
So let's just say, and we'll use you and I as the example.
Okay.
If we were to stay this close for 10 minutes and I were to test positive,
Okay.
you would need to quarantine from 14 days from today's date.
Gotcha.
And the 14 days is important because the CDC and World Health Organization say that it takes between 2 and 14 days from that point of contact to really determine if you're actually going to develop COVID-19.
Gotcha. And let's delve in a little bit further. Think of some more scenarios. I know there's some common things come in. And in saying that, we can tie this into it. If you get a letter from the school, and I know that if that happens, if you're a parent, that can certainly be alarming. But if you receive a letter, what exactly does that mean if you get a letter from the school?
Okay. We have 2 layers of notification. There is a notification letter if there's a student or staff member that tests positive. We're going to send a notification letter to every member of every group the COVID positive person is a member of. So if you're a high school student, you have 8 classes. There are 8 classes. Our parents for all the students in all 8 classes are going to receive that notification letter. That does not mean that they met the 6 foot 10 minute benchmark.
Right.
It is a courtesy just to make sure they know
Exactly.
that there's been a COVID case found in a group that their child is a member of.
So from that point, watch for symptoms.
That's exactly right.
The letter is a signal to watch for symptoms, because it doesn't mean necessarily your child had that interaction for the period of time. It is a courtesy letter to say, look, someone your child may have come in contact with, not knowing if it was a specific amount of time or whatever. It is a courtesy letter just to give you a heads up to say, hey, I want to let you know, just be on the lookout. If you see any symptoms or detect anything with your child, then just take action from there to do the proper things, which again are on the sheet that's on the link included with this post or email.
The second layer, and as I said, the administrators are working very, very hard. They spent a lot of hours doing really an investigation for contact tracing. Those individuals, whether it be staff or students, who have been found to be within 6 feet for 10 minutes or longer, are going to get a phone call, a live phone call, not a robocall or anything like that. They're going to get a live phone call from an administrator. Administrators are the only ones that are going to do this. And they're going to be told that they were determined to be a close contact, that there is that 14-day quarantine coming, that based on the last date of contact, and we are bound. We have to share that information with the Tennessee Department of Health. The Tennessee Department of Health contact tracers will be monitoring. Their team will be monitoring all the close contacts for each COVID positive case in Wilson County and every other school district in the state.
Chuck, think of some of our more complicated examples that have certainly maybe scratched a lot of people's heads to say, like, okay, what do I do in this situation? When you think of that, what comes to mind?
There is, and some people have called it the 24-day rule, which is the Tennessee Department of Health had put out a mandate. It started off as a guidance. We now have a mandate. But if there is a positive COVID case in the home, again, using a real world example, let's say one of my children tested positive. There is, and as we said earlier, there's that 10-day isolation period, and then there's a 14-day quarantine for close contacts. Well, we live under the same roof.
Right.
So the oldest child living at home, if he were to test positive, my youngest child would have to stay at home in isolation the same 10 days that my oldest child does.
Okay.
So the onset of symptoms if he's symptomatic, or the positive test date if he's asymptomatic. But there's that 10 days that both of them are staying home. Only one of them is tested positive. Because of the close contact quarantine, my youngest, who is not tested positive, has to stay home an additional 14 days quarantine because the close contact.
Right.
So it's not necessarily a 24-day rule, but he would have to be, and quite frankly, I would have to stay home that period as well. If my 17-year-old tested positive, I would stay home in isolation for 10 days, and then I would also stay home in quarantine for 14 days. That's a scary thing. That's up to 24 days. And we've just got back to school. That is a scary, scary thing to be thinking about and trying to juggle schedules. But the reason Tennessee Department of Health has that and the CDC guidance dictates that is, in theory, my 17-year-old could give it to us on day 9, day 10 of the isolation. It would take could take up to the full 14-day quarantine for symptoms to start developing in me or our youngest. So that's the new little wrinkle that really got pushed out a couple of weeks ago. It was early August that we learned that was one of the rules of engagement. Right. It was not a recommendation; it was a mandate, and that's been a tough one to handle. The school system has worked diligently to make sure we have some wraparound services educationally for folks that are impacted by that rule. We've got a new term, COVID bound, and a lot of information's gone out. We don't want kids falling through the cracks. We don't want them losing 3 weeks of instruction. So the school nurse, Tammy Crane, is our homebound coordinator for the school district. Guidance counselors can tap in. So if that's something that impacts, if your child's under a quarantine order because they're close contact, or they have to isolate and quarantine because of a COVID positive case in the home, we can tap into that and make sure that they're keeping up and they're getting those educational services during that 14 to 24 day period that they won't be allowed to come back to school.
Well, Chuck, thank you so much. A few quick reminders before we wrap this up. We know this is taking a little bit of time, but we do know that it's important. It's important to know that people have a grasp of understanding, because look, folks, it's kind of like a big math problem on this sheet. Again, it's on the link. If you're sick, don't come to school. Okay. If you're sick, do not attend one of our athletic events. Cheer from home. You can stream a lot of these games online, especially on football Friday nights, or in this case, football Thursday nights for the weather for this week. So if you're sick, stay at home and those sorts of things.
If you're in isolation or quarantine, those are excuse days.
Yes.
So don't fret that. We still want to help people stay in the loop educationally and not fall too far behind. But just because you have COVID, you're not going to end up in truancy court or getting in trouble for not sending your kids to school.
There's a tremendous amount of support and understanding through these challenging and unprecedented times, and please know that. Please understand that. That has been made very, very clear throughout the past several months, that we know that we're all navigating through a time that is very, very unpredictable, and it comes with its challenges, no doubt about that. Chuck, is there anything else that you want to add? Also, if you do have a positive test or a positive test in the home, do not delay. Do not go a few days and say, well, I think my mom or my dad, our schools have to know, for us to get back to traditional sooner rather than later, we've got to be doing the right things, and speak a little bit about on that, to not delay if there is a positive case in the home.
Yeah, I mean, all these precautions, all these action steps are here to really choke out the virus. We want the virus to just go someplace else. Right. We want to get back to traditional as quickly as we possibly can, and that's our comfort zone for students and teachers and administrators, athletic teams. We want normal, but we've got to do a few things to get back to normal. I had one other thing that just kind of popped into my head. If a student or staff member has been put on quarantine, we have that. We did say the CDC, it takes between 2 and 14 days for symptoms to emerge if you've actually caught it, which is why the 14-day quarantine's there. Just because you get a negative test during the quarantine doesn't negate the 14-day. Okay, that's something that's kind of popped up in the last couple of days. We've had some folks that have been identified as close contacts and have to quarantine. and they'll go get a test right away and it's negative, but it takes several days in order to, just because they tested negative on day 2 doesn't mean they won't test positive on day 13. So that's why that quarantine is a full 14.
Chuck, as always, very, very useful information. And again, if you have questions, please reach out to us. But again, this is it's not an easy time, but it's a time that we're trying to all get through together. Chuck is constantly evaluating local health data and receiving guidance from the Tennessee Department of Health. So again, we appreciate your hard work on what you're doing. And again, this information, as we know, could change in the next week or so. So there's been a date stamp on this video to let you know when we did this interview and this banner back and forth, because it could change. And if anything significant does change involving protocols and those sorts of things, we will be sure to let you know. And if Chuck and I have to do this every week or every other day, if things change significantly, we will do that. So, Chuck, thanks for your time. He is our Wilson County Schools Health Services Supervisor, and I'm Bart Barker with Wilson County Schools. Have a good rest of the day.